All right, let's dive right in. Today, we're putting on our detective hats. Our case, cracking the code on two of the most common and, let's be honest, kind of confusing numbers you'll see on a lab report, BUN and creatinine. So, let's get this investigation started.
You know that feeling, right? You get your blood test results back, you're scanning through, and suddenly it feels like you're trying to read a completely different language. If that's you, you are definitely not alone. But trust me, by the end of this, you'll see these aren't scary terms. They're just valuable clues to your body's story. So here's our game plan. We're going to start with the big picture of kidney health. Then we'll investigate our two main clues, BUN and creatinine. After that, we'll figure out what it might mean if the numbers are a little off. And, most importantly, what to do next. Okay, first things first. Let's talk about the real stars of the show here, your kidneys. They are, without a doubt, your body's master filtration system. I want you to think of your kidneys just like a super sophisticated, high-tech filter for your blood. 24/7, they are working away, pulling out all the waste products and extra fluid that your body doesn't need. That stuff then leaves your body as urine. So these lab tests, they're basically just a performance check on that vital filter. All right, detective, let's grab our first piece of evidence. We're going to start with something called blood urea nitrogen, but you'll almost always see it abbreviated on your report as just BUN. So what in the world is BUN? Well, it all starts with the protein you eat, from things like chicken, beans, or a protein shake. Your body uses that protein, and like any process, it creates some leftover waste. Your liver then takes that waste and converts it into something called urea. The N in BUN stands for the nitrogen part of that urea, which is what we're measuring in your blood. This breaks down that journey perfectly. When everything's working smoothly, it's a simple three-step process. You eat, your liver does its job, and then your healthy kidneys filter all that urea out. So the BUN test is just a snapshot, measuring how much of that waste is hanging around in your blood at that moment. Now, for most healthy adults, that snapshot should show a number somewhere between 8 and 23 milligrams per deciliter. That gives us a baseline, right? A target range. But, and this is a really big but, BUN can be a pretty sensitive clue. It can be a little jumpy. And this is exactly why. Just look at all the things that can nudge that number up or down. If you had a huge steak for dinner last night, your BUN might be higher. If you're dehydrated, that's a huge one. Less water in your blood means the waste is more concentrated. Even your age or just having a fever can make it fluctuate. This is why doctors never ever look at BUN all by itself. So that brings us to our second clue. Let's see how this one helps tell the rest of the story. This is creatinine, and it's generally considered a much more steady and reliable indicator of how the kidneys themselves are doing. See, unlike BUN, which is tied so closely to your diet, creatinine comes from your muscles. Just by living your life, walking around, picking things up, basically just moving, your muscles are constantly breaking down a substance called creatine, and the waste product from that is creatinine. The cool part? It's produced at a very, very steady rate. You'll notice the normal range for creatinine is a lot smaller, usually somewhere between 0.6 and 1.4 milligrams per deciliter. And because it's directly linked to how much muscle you have, it's pretty common for men to have slightly higher levels than women. Okay, let's put these two side by side, because this is where it all clicks. Think of BUN as a noisy signal. It can bounce around for a lot of reasons. Creatinine, on the other hand, is a much clearer, more stable signal that points more directly to how well those kidney filters are actually working. That's why your doctor always looks at them together. Okay, we have gathered our clues. We know what they are, so now for the part everybody really wants to know. What does it mean if these numbers are high or low? It's time to analyze the evidence.
But hold on, before we go any further, I want to pause right here. This is so important. A number on a lab report is just one piece of a much, much bigger puzzle. It's a signal, a flag for your doctor to maybe look a little closer. It is not a diagnosis. So let's break this down. You can see how something simple like dehydration can make both BUN and creatinine pop up high. But a high creatinine all by itself, that's a stronger signal for a doctor to really focus on the kidneys. And look at the other side. Low numbers tell a story too. Low BUN could have to do with your diet, while low creatinine might just mean you have less muscle mass. It's all about how these clues fit together to form a picture.
All right, we've defined the terms, we've analyzed the clues. Now for the final, and I think the most powerful section, what do you do with this knowledge? This is all about turning these clues into a productive conversation. I'm saying this again because if you take away one thing, this is it. Please, do not panic if you see a number that's flagged as high or low. See it as an invitation. It's your body giving you a starting point for a conversation with your doctor. It actually empowers you to be an active partner in your own health.
So what does that conversation even look like? Well, your doctor is going to put these numbers into context. They'll look at your whole health history, the medications you're taking. They'll probably order some other tests just to get a clearer picture. From there, it's a discussion about lifestyle and working with you on a plan. It's a logical, step-by-step process, not a sudden panic.
And that's really the goal here, isn't it? When you understand these clues, you're no longer just a passenger along for the ride. You become an informed partner, a co-detective, ready to ask the right questions and truly understand the fascinating story your body is telling you.